for your ratio. So, what we're going to do is that sometime nag-ratio ko, may time man nga ma-discuss ko or ma-lecture ko sa mga related bala nga topics para hindi ta mag-uyang sa aton time. So, bali, ratio with discussion na dayon kita, ha? So, along the way, if you have questions, pwede ka raise ang hand, pwede man ka type sa inyong questions, okay? Sige, so number 1, the energy value of food component is expressed in, so what
Calorie.
is, yes, calorie, very good. So, calorie is the amount of energy released when your body breaks down or digests and absorbs food at the same time. So, masaylo-saylo ko sang i-present kung screen kaysa piyak ang akong PowerPoint for discussion lang. Hindi na masaylo, dali ng hindi matuman. Hindi ko kas dali lang, hindi ko kasaylo sang screen. Wait lang gid guys, ha, dali lang gid. Problema ako nga screen siguro.
Doc,
Yes, ma'am.
pwede man Doc, i-stop presenting mo danay, then kadto ka sa screen nga gusto mo i-present, then start kaliwat present pi Doc. Try lang.
Sige. Sige, sige ma'am. Thank you gid. Sige, sorry na siya. So for calorie, calorie is a unit. So it's like a unit nga ginagamit like inch, meters, inches, gray. So it is also a measurement of the amount of energy released when the body breaks down the food that we eat. So mag-break down, it means both either digest or absorb the food. So meaning the more calories the food have, the more energy it can provide in the body. So it is a measure of energy spent and energy stored in the body. So the calories referred to in diet, so calories eaten, ang aton nga term ginagamit, and also the calories that we burn when we exercise, and it is measured in kilocalories. So for conversion purposes, 1 kilocalorie is equal to the amount of heat that will raise the temperature of 1 kilogram of water by 1 degree Celsius at sea level. So, magsiling kita nga kilocalorie. So, it is kuno the amount of heat nga pwede maka-increase sang temperature sang 1 kilogram of water at sea level. So, do ka complicated siya. Pero basta mo na naman sila nga kilocalorie. So, the amount of heat nga maka-raise sang temperature sang 1 kilogram of water at sea level. So 1 kilocalorie is equal to about 4,186.8 joules. So amo na siya answer sa aton nga first question. So for the other choices, joules and electron volts are also the units of energy. So for the SI unit for work and energy is the joules. So 1 joule is equivalent to a force of 1 newton. So ang aton unit naman sa newton, if naka-discuss na kamo sa inyong rad physics, so the unit of force is newton. While the joule is the unit of work and also the unit man siya sang energy. So it is the force of 1 newton exerted through a distance of 1 meter. So to translate it into a mathematical equation, so 1 joule is equal to 1 newton meter or newton times meter. That is the SI derived unit. So may, if you can remember, man sa inyong rad physics, may ara kita nga special units, may ara kita nga SI units. Ang aton nga SI units, divided na siya into SI derived unit and SI base units. So if you can remember, ano ang aton nga mga examples ng SI base units? Kung madamdaman niyo pa? Nakatapos na ka mo review sa rad physics? Or wala pa? Ini may gisabat sa ilaman. Guys, ano ka mo nakulbaan? Nagutom? Sakit na inyong ulo?
Ano to, Doc? SI base units?
SI base units, ha. Examples ng SI base units.
Length? Mass? Time?
Yes, correct. So, amo na examples ng SI base units ta ha. So, we have the mass, the length, and the time. So, ang sa aton nga energy, ang SI base unit niya, so that is the combination, kumbaga naging mo na siya nga derive na i-combination sa base units. So, ang aton nga derived unit. So, again, to make it clear, ang SI derived unit, halin na siya sa SI base unit. So, usually, ang aton nga base units, may kita na 7. So, aside sa time, length, mass, we have also the temperature, then the intensity of light, which is the candela, etc. So, ang combination na nila, kung i-combine ta na ang ilang mga units, nagakadto na siya sa SI derived unit. So, ang aton nga example diri sa 1 joule SI derived unit is dali lang ha, important. So, sorry for that. So, again, ang aton nga SI special unit, SI derived unit is 1 kilogram meter squared per second squared. So, that is equal to 1 joule or also, in other form, 1 Newton meter Also, kung i-convert ito ang aton nga joules, so 1 joule is about 0.239 calories. Kung the other way around, kung hinatag ko kagi nga value, 1 calorie is 4.187 joules. So another unit for energy is electron volt. So this is a special unit na ginagamit specifically when we are talking about the energy of the X-rays, the gamma rays, and other electromagnetic radiation. So sa busyong, ang definition, kung magawa mo siya sa board exam, usually amo man ni ang definition sang electron volt. The energy that an electron gains when it travels through a potential of 1 volt. So potential or potential difference is the same with our voltage. So pareho lang na, lain-lain na siya nga term, pero voltage man nagyapon, potential difference, or voltage. So they are the same. Or another definition, most common na ginagamit kung nag-discuss kita sa energy sa electromagnetic radiation, the energy acquired by an electron through a potential difference of 1 volt. So again, magsiling kita nga electron volt. This is also a unit of energy. Specifically, ginagamit ni siya for the energy sa aton nga electromagnetic radiation such as X-rays and gamma rays. So for conversion processes or for conversion purposes, 1 electron volt is equal to 1.6 times 10 to the power of negative 19 joules, or 1 joule is equal to 6.2 times 10 to the power of 18 electron volts. So that's it for our discussion. So heat refers to the thermal energy. So magsiling kita nga heat. So it refers to thermal energy, and it is the ability of a system to do work and the change of energy. So heat is the energy being transferred between substances or systems due to a temperature difference between them. So if there are two or more substances that has a different temperature, so there is a transfer of energy, and that is in a form of heat. Okay, so next question. So ari the per minutes sila gagawa sa board exam, to pila na ka beses nagwa na siya sa board exam ang pectus excavatum, pectus carinatum. So these are the signs sa mga congenital diseases. So a condition in which the sternum or the breastbone protrudes or sticks out more than usual and commonly known as pigeon chest. So kaya ang iyang appearance do pigeon kuno. So the correct answer is, anong correct answer? Sa mga butanan kamahipuson. So it is a pectus carinatum. So for the pectus excavatum, so muna yung natang i-discuss, pectus excavatum, this occurs in a baby who is developing sa womb pa lang. So, and usually dira siya nagasugod pa lang sa arap sa tiyan sang mother, pero it can also be developed. So posible pwede siya mag-develop even after birth. So pagbata sa iya, pwede nga may pectus excavatum na siya, or pwede nga after birth or sa nag-develop siya dira pa lang masugod. This is due to too much growth of the connective tissue that joins the ribs to the breastbone. And because of this, it causes the sternum to grow inward. Sorry. Resulting to a depression in the chest over the sternum. So, ang pectus excavatum is the opposite more or less of pectus carinatum. So kung ang pectus carinatum nga nagaulbo siya, nagaprotrude, ang excavatum niya pasulod, may depression. So sometimes if the condition is severe, the heart and lungs can be affected. So the exact cause of pectus excavatum is unknown, pero present siya most likely sa different syndromes, congenital abnormalities present ang pectus excavatum such as the Marfan syndrome or a problem with the connective tissue, the Noonan syndrome, which is a disorder that causes many parts of the body to develop abnormally, the Poland syndrome, a disorder that causes muscles to not develop fully or not develop at all. So, pwede nga partially developed lang, pwede nga wala gid nag-develop sa Poland syndrome. Actually, may mga pictures ko dakag i-discuss ko siya ang very brief overview lang sang different syndromes nga nagapresent sa pectus excavatum. Also, present man siya sa mga children suffering from rickets or the softening and weakening of the bones, as well as sa persons nga may scoliosis or the abnormal curving of the spine. So this is an example. So this is an example of a picture of a person or a child suffering from Marfan syndrome. So it is an acronym sa iyang based sa iyang mga signs and symptoms presented. So mitral valve prolapse, aortic dissection, regurgitation of aortic valve. So fingers are long or termed as arachnodactyly. So laba ang iyang nga arm span, tapos taman siya kataas. Abnormally tall, nasal voice, ando po nga siya magambal, bala do foreigner siya magambal, the more on hangin because of the high palate, and also the sternal excavation. So, Marfan syndrome is an inherited disorder. So, pwede siya ma-inherit kung no, that affects the connective tissue, the fibers that support and anchor the organs and other structures in the body are affected. Marfan syndrome most commonly affects the hearts, the eyes, the blood vessels, and the skeleton. So, amo na siyang ginambal ko ang systemic syndrome sang Marfan. Amo na yung mitral valve prolapse, aortic dissection, and so on. So, sa first nga iyang syndrome, we have the mitral valve prolapse. So, aras sa tunga. The leaflets of the mitral valve bulge or bulges or nag-prolapse. So, naghahabok siya. As you can see, there is sa aton nga area. So, ari siya gahabok. Compare mo siya sa normal. Ari. So, the valve leaflets balloon upward or naghabok siya as the ventricle contracts. So, amo na siya ang prolapse kung ang person may Marfan. And maskip ta sa aortic dissection, mauna ta sa may regurgitation of aortic valve. So, ari siya ya. So, valve leaflets do not properly close, forcing the blood back into the atrium. So, ari, nagbalik ang blood. So, kay wala siya nag-close properly, ari, may ari siya nga gap diri nga portion. So, that is regurgitation. So it is a condition, ang regurgitation, condition that occurs when the heart's aortic valve doesn't close tightly. Okay, so next is the aortic dissection. So ari siya. So it is a serious condition man kung mag-occur siya that needs immediate medical attention. So this is where a tear, so nagisi siya, occurs in the inner layer of the body's main artery which is the aorta. So kung magisi ang aorta, so amo na siya tawag nga aortic dissection or aortic tear. So the blood rushes through the tear, so dira na maagi bagwa ang dugo, causing the inner and middle layers of the aorta to split or to dissect or magisi. If the blood goes through the outside aortic wall, so aortic dissection is often deadly. So kung matabo ni siya, so it can be deadly or fatal. So muna kinahanglan nga masik gid immediate medical attention. Next is the fingers that are long. So, amo na siya ang sa picture ta. As you can see, lagba sang iyang mga tudlo. Tapos iya man nga kamot sa arm span niya. Tamaan siya kalaba, are. So, i-compare mo siya sa proportion sa iyang lawas. Then, we also have the nasal voice or the high palate. So, arin na discuss ko naman kagina ang regurgitation. So, wala na siya magsira maayo. Sa mo na yung example man sang arachnodactyly. So, kalagba-lagba sa iyang mga tudlo. Also, ari, laba iyang nga reach, iyang arm. And for the nasal voice or high palate, so tamaan siya kataas ang iyang ari o nga area. And lastly, the sternal excavation or ang aton nga pectus excavatum. So usually, sorry. Kamu na nagaulbo ang iyang chest o may excavatum. So next, this is also ang itsura sang child suffering from Noonan syndrome. So kagina na-discuss ito yung Marfan's. Next is ang person suffering from Noonan syndrome. So usually, ang yang itsura, so inverted triangle-shaped head, as you can see. Tapos, coarse ang facial features, do kagara siya. Ang buhok is curly or woolly hair. Wide forehead, and then there is a webbing sa iyang liog, the web siya, are. Gamay iya chin kay inverted triangle, then there is also pectus excavatum. So widely spaced nipple and cubitus valgus, deformity of upper extremity. So dire bala no nagatiko siya gupagwa. So it is a genetic disorder that prevents normal development in various parts of the body, especially sa facial features kay sa chest. Deformity, nag-occur man siya. A person can be affected by Noonan syndrome in a wide variety of ways, which include, mention ko bago lang, unusual face characteristics, putot siya, short stature, heart defects, and other physical problems and possible developmental delays. So usually, amo niya nga itsura sang person or a child suffering from Noonan syndrome. So there is a webbing, gamay iya chin, iyang buhok, and then ang iyang forehead kag ang inverted triangular shape head. Next, for Poland syndrome. So it is a disorder in which affected individuals are born with missing or undeveloped or underdeveloped muscles on one side of the body, resulting in abnormalities that can affect the chest, the shoulder, the arm, and hand. So bali ang sa Poland syndrome, dubangian, bala ang piyak na side sang iyang lawas, so wala siya nag-develop. Wala nag-develop or underdeveloped. So as you can see, so bangian iya nga chest area. So sa likod niya mo man hindi man siya parehos, the same man diri sa iya nga kamot. So that is for Poland syndrome. Next, for rickets. So rickets is a condition that affects the bone development in children, and it can also cause bone pain, poor growth, and soft, weak bones that can lead to bone deformity. So, nang weak ang iyang bones sa children suffering from rickets. So, usually, sa bata siya nag-occur, pero possible man, there are also cases reported nga nag-occur man siya sa adults. And kung sa adult ya, ang tawag is osteomalacia. So kung sa bata, ang tawag is rickets. Sa tigulang, so more or less the same man ang signs and symptoms, pero ang term is osteomalacia or soft bone. So as you can see there, so the comparison between the normal bone and bones with rickets. So amo ni siya. So ariyan, dasig lang siya maguba. So usually amo ni ang itsura sang person or sang child nga suffering from rickets. So you can see the deformity affecting their lower extremities. So are. So sa 5 years old, 6 years old, 12, 17 siya. So next is scoliosis. So, ang scoliosis is a sideways curvature of the spine. So, as you can see there as a picture that most often diagnosed in adolescents. So, usually hindi siya sa bata, sa mga teenagers. Pakadto na sa adult eh. While scoliosis can occur in people with conditions such as cerebral palsy and muscular dystrophy, the cause of most childhood scoliosis is unknown. So kung may mga bata man nga nag-suffer sa scoliosis, so usually kung unknown ang cause, pero present man siya kung ang person may cerebral palsy or muscular dystrophy. So there are different types of scoliosis. So we have thoracic scoliosis, of course, which affects the thorax, lumbar scoliosis, thoracolumbar scoliosis, and combined scoliosis. So because of this abnormality sa spine, so pwede man siya mag-present sang pectus excavatum. So may depression sa chest area. So what is the difference between scoliosis, kyphosis, and lordosis? So may mga times mga nagwa siya sa board exam before. So tandaan lang kung scoliosis, letter S, so side, so sideways. Kyphosis, so kuba, di ba? Kung kuba ka muna ang kaimulikod na gamo niyo. So letter K, and then lordosis, so L for lumbar area. Muna, so scoliosis, so side, so pwede siya sa lumbar, pwede siya sa thoracic, pwede man siya thoracolumbar ang scoliosis. Kyphosis siya sa thoracic area siya, pero ang iyang korte, so amo na nagakub-kub siya, nakakuba, letter K. Then lordosis, so L is for lumbar. So, amo na itsura sa pectus excavatum. So, there is a depression sa chest area. So, breastbone is sunken. So, sometimes nga tawag na siya nga sunken chest. Severe cases of pectus excavatum can eventually interfere with the function of the hearts and lungs. Kaya gina-push niya inward ang lungs kag heart. So, budlay maginawa. It is a condition in which a person's breastbone is sunken into his or her chest, and pectus excavatum comes from the Latin word or Latin terms which means hollowed chest. So pectus is chest, excavatum is hollow. So sometimes base sa mga choices, hindi ka mo makakita sa pectus excavatum or sunken chest. So sometimes ang iba niya na nga term is cobbler's chest or funnel chest. So pectus excavatum is a structural deformity of the anterior thoracic wall in which the sternum and rib cage are shaped abnormally. Again, it can either be present at birth or it may develop later na. It can impair, as I mentioned, cardiac and respiratory function. They also may experience severe negative psychosocial effects. So, syempre, nahuya sila kay hindi normal ila chest. So, pwede ma-depress. And the hallmark of the condition is a sunken appearance of the sternum. So, magsiling kita nga hallmark, mo ginang pinaka-sign niya bala, kumbaga pinakasikat niya nga sign, mabalaan, mga may pectus excavatum siya kung there is a sunken appearance of the sternum. So, kung ang pectus excavatum may depression or hollow diri nga part, ang pectus carinatum niya, pagwa naman siya. So, this is uncommon birth defect in which a child's breastbone protrudes outward abnormally. So, this is caused by the abnormal development of the cartilage that connects the ribs. But of course, the same sa atong pectus excavatum, the exact cause is unknown. So, mo nang tawag siya nga pigeon chest. So, daw mo na itsura sang pigeon nga chest, di ba? So, similar to that. So, next is, ari nagwa man ni sa board exam, kay usually, ang mga items diri ginkuha kunin sa mga nalista namon sa mga previous nga board exam nga mga natandaan bala sa mga students. So, ari naggawa man ni ang next question. So, I hope makita niyo da sa inyong nga copy, sa inyong scores, ang mga questions, or i-share ko na lang din. Mga baylo-baylo lang ta screen. So, mo na ang isang sunken chest, pareho na sila sa pectus excavatum. So, which of the following is assigned by the pharmaceutical company that first develops a drug? So, the correct answer is generic name. So, first develops a drug. So, usually, among gina siyang una-una, ginahatag nga ngalan. And then, after na kung ma-develop na siya, so, tagaan na siya sang brand name or trade name. So, what is the difference between a chemical name, brand name, and generic name? So, nagwa mo na siya sa board exam before. So, masaylo naman ta sang aton nga screen. So, generic name is the name of the active ingredient assigned by the pharmaceutical company that first develops a drug. So, usually, magamba kita generic name. So, usually, ngalan na siya sang active ingredient sang bulong. So, later, sa next slide, may example ko da. While a chemical name is a scientific name based on the compound's chemical structure. So, usually, dito na siya makita sa label sa bulong ang chemical name, pero makita ta na siya sa mga leaflets na bala kung magbakal kita sa bulong nga naka-box. So, usually may papel kada nga makita nga bala sahon, so dira mo na makita ang chemical name. Pero kung sa mga puto sa bulong like sang Biogesic, like sang Alaxan, sang paracetamol, Bioflu, ang makita talanda usually is the generic name kag brand name. While for the brand name, which is also referred to as the trade name, This is the name given by the company that makes the drug and is usually easy to say for sales and marketing purposes. So, ang brand name, masapos siya i-pronounce, masapos i-spelling compare sa generic name. Kay dasig siya matandaan, so ginungod gina siya para dasig siya madumduman, kagapos maghambal kung magbakal. So, muna generic name, so usually halina siya sa main or sa active ingredient, sang bulong, chemical name, so that is based on the compound's chemical structure na gingamit sa pag-ubra sa bulong, and brand name, ang muna iya nga trade name. So example, I have here generic chemical and brand name. So we have fluoxetine hydrochloride. So as you can see, ara iya nga chemical name. So N-methyl-3-phenylpropylamine. So that is the compound structure. So simply, para po siya tandaan, your brand name is Prozac. So Prozac, ginagamit na siya for depression. Ginagamit siya to treat depression. Another example is acetaminophen, which is the generic name. Chemical name is 4-hydroxyacetanilide, and the brand name is Tylenol. So Tylenol, this is used to treat mild to moderate pain. So for pain management. And another example is ibuprofen. So 2p-isobutylphenylpropionic acid, or the brand name is Motrin. So example, manasang ibuprofen, so medical, common sa aton. So this is used to relieve pain, pareho man sang acetaminophen. So it can relieve pain from various conditions like headache, dental pain, menstrual cramps. So kung nag-abot ang tiyan, muscle aches, or arthritis. So pwede man siya actually magamit ang Tylenol or ang acetaminophen. Pero kung i-compare mo sila nga duwa, ang acetaminophen sa ibuprofen, mas nami ang ibuprofen. Kumbaga mas isog siya. So, I mean, isog siya, bala nga mas effective siya to treat pain. Kay acetaminophen is only effective at relieving pain and fever. So, pain kag fever lang iya nga matreat or ma-relieve, while ang ibuprofen, so pain, fever, kag inflammation. So, tatlo iya dala. So, mas, kumbaga, dako ang coverage ang ibuprofen. So, muna examples ng generic name, chemical name, kag brand name. So, next question is, so last year nagwa man siya sa board exam. What is the name given to a closed glass container with a rubber stopper? So ang iya nga taklob do rubber siya. So that is a vial. So, ang barrel, tiyan mo na itsura niya. Usually, this is made of wood, ang barrel. So, kung i-convert na siya, one barrel is about 119 liters of fluid. So, syempre, wala na ginagamit sa medical. Yeah. So, another one, we have the ampule. So, this is a small sealed vial used to contain and preserve a sample. Usually, ang sulod sang vial, asang ampule, is a solid or liquid medication. So usually, ang ampules are made of glass, and subong, may ara naman nga made of hard plastics. Pero very rare. Usually, ang makita ta subong glass mangyapon ang container sang ampule. So modern ampules are most commonly used to contain pharmaceuticals and chemicals that must be protected from air and contaminants. So usually, ang ampule for single dose lang na siya, hindi siya pwede matunga. Unlike sa vial nga pwede, kaya ka extract small amount tapos later pwede ka naman kakuha liwat, tutunga-tungaon siya. So vial na siya. Pero kung ampule, usually for single dose na siya. So yan ang liog-liog na as you can see dere. So ginabali na siya kung magkuha na sang bulong. So ampule refers to a single dose of medication pre-packaged in an injectable glass or plastic container. So single dose ha. And for vial, so other term for vial is flacon or vial. So type ko da sa aton GC. So kay base ang lain ang ma-encounter nyo nga term. So other terms ang vial is flacon or vial. Ay, sorry. Na other term yun na. So this is often used to store medication as liquids, powders, or capsule. So again, ang vial, pwede siya single dose, pareho sa ampule, and pwede man siya nga multiple dose. Kaya mo tambal ko kagina, pwede siya kuan lang, kuan mo siya subong, tapos later naman ang bilin. So that is for multiple dose vial container. So may rubber stopper that is vial. So next question. What is the abbreviation for before meals? So before meals, so many mga common abbreviations, medical abbreviations yung ginagamit sa hospitals or sa clinical setting. So STAT, a common medical abbreviation for urgent or rush. So it is from the Latin word statim or statim, which means immediately. So muna ang stat. So ASAP. PO means by mouth or from the Latin word per os. Os is mouth or opening. PC is after meals or P stands for post. Post is after for your medical term. And C is sebum or meals. So again, usually ang ato nga mga medical terms, halina siya sa Latin words. So may ara man iban nga from Greek words, from Chinese words, pero most of them, a majority halin sa Latin words. And AC is before meals. A for ante or before, and sebum, so that is again meals. So, ang aton nga answer, abbreviation for before meals is AC. Next, medical term which refers to both eyes. Last time, 2 years ago, nagawa na siya. OU ang answer. So, OD, meaning right eye. So, again, from Latin word, oculus dexter. Dexter is right. Sinister is left. So, OS is oculus sinister, meaning left eye. And OU, oculus oterque, meaning both eyes. So, usually, kung may mga eyeglasses, kamo may mga antipara na kamo, may mga grado, makita nyo na sa prescription sa inyong ophthalmologist or optometrist. So, OU, both eyes. So, next question is, It attaches the liver to the front body wall and separates the liver into the left medial and right lateral lobe. So this is the falciform ligament. So falciform ligament. So I will discuss the ligamentum nuchae, ligament of Treitz or traits, ligamentum flavum. So the ligamentum nuchae is a large median ligament composed of tendons and fascia located between the posterior muscles of the neck. So this is the ligamentum nuchae. It covers the spines from C1 to C6 usually. Kaya sa C7, medyo nagalabaw na di siya. So, ang ina-cover niya is from C1 to C6. So, when we say ligament, these are bands of tough elastic tissue usually around the joints. So, ang ligaments, nag-connect na siya sang bone to bone and also gives the joints support and also at the same time limits the movement of the joint. So, muna magsilingkit nga ligament, so bone to bone na niya gina-connect. So, that is for ligamentum nuchae. For the ligament of Treitz, so this is a thin band of tissue that connects and supports the end of the duodenum and beginning of the jejunum in the GI tract. So it is also called the suspensory muscle of duodenum. So ligament of Treitz, so dira siya sa duodenum. So ara naga-support siya sa aton nga duodenum pakadto sa jejunum. Pare. So sa end, so this is the end of our duodenum. Usually ang aton nga duodenum nakagasi na siya. So ang end niya is here and then the beginning of the jejunum. So ang naga-support is the ligament of Treitz para hindi siya mahulog diretso pa dalom, kinaon diretso sa dalom. Then we have the ligamentum flavum. So this literally means a yellow ligament and known because it has a yellow coloring due to the amount of the elastin. So elastin is a springy type of collagen. Those spring type siya nga collagen ang elastin. The function of the ligamentum flavum is to maintain the upright posture. Like kung magduko ka, may puluton ka, or magbend ka, so makatindog ka balik, ma-maintain ang upright posture. It helps to preserve the normal curvature of the spine and to straighten the column, the spinal column, after it has been flexed. So normally, if you have noticed, kung dugay ka nagabend, dugay ka nagaduko, when may kailang nagaduko sa imong nga cellphone, so usually, nung matsika ka na nag-aalay, kaya ang imo da nga ligamentum flavum, kinala na magbalik sa iya nga normal position. So sa MRI, ang muna itsura niya, so this is a T1 weighted image sa aton nga ligamentum flavum. And then this one is the T2 weighted image sang ligamentum flavum. So ma-discuss niyo man na siya mga appearance, mga T2 weighted images sa MRI niyo nga discussion sa right side. So ari siya sa tungaang yellow portion ni bala, that is the ligamentum flavum. And for the falciform ligament, so it attaches the liver to the front body wall, then separates the liver into left, medial, and right. Ari lang siya. So left, separate niya ang right kag left lobe, or right lateral kag left medial lobe sang liver. Again, gaguluwa na sila sa board exam. Okay, so far may questions ka mo guys, intindihan lang, can you still follow? Basi gahiram na da inyo chan, o natuyo pa ka mo. Okay lang?
Okay lang, Doc.
Okay, so next question, the most abundant macromolecule. So it is proteins. So sa aton lawas, we have 5 major molecules in the body. I hope matandaan nyo na sa inyong rad bio. So we have the water molecules, we have the proteins, carbohydrates, nucleic acids, and ang aton nga fatty acids or the lipids. So sa ila na nga 5, so wala na din madala ang lipid, sa ila na nga 5, ang molecule na sila ha, molecule. Ang simplest is water because it is only made up of 2 molecules which are the hydrogen and oxygen. And then ang apat, they are considered as macromolecules. So we have the nucleic acids, the lipids, the carbohydrates, and protein. So gintawag na sila nga macromolecules because they are composed of hundreds, basta more than 2, damo siya nga pagka-molecules, hundreds or thousands of molecules. And sa ila naman nga apat, again, ang aton nga apat ka macromolecules, nucleic acids, lipids, carbohydrates, kag proteins. Sa ilang apat, may ara kita ginatawag nga organic molecules. Organic molecules are composed of lipids, carbohydrates, kag proteins. Okay? So, ang nucleic acids, wala na siya nadala sa organic molecules. Gintawag na sila nga organic molecules ang carbohydrates, proteins, kag lipids because they contain carbon and they are life-sustaining. Okay? So, I hope natandaan nyo na. So, proteins, again, is the most abundant. And also, it is the workhorses of the cell. So, masiling kita nga workhorse, daw mo gina siyang nagabaka-baka, damo siya obra, damo siya functions. So, they are the most abundant. Ang proteins, the workhorse man siya. And it has a versatile function. So, damo siya functions. So again, balik ta sa inyong rad bio. So the three of the most common and important functions of proteins are proteins act as an enzyme, hormones, and antibodies. Okay? So muna versatile ang functions niya. So every part of the cells, every part of our body is composed of, so may ara gid siya nga proteins. So kung ang protein is the most abundant macromolecule, the least abundant is the DNA. So gamay na iya ang DNA sa aton nga lawas. That is why it is referred to as the target molecule because gamay lang siya pero at the same time important ang iya nga function. Okay, so next, which of the following structures is not superior to the mediastinum? So, ang hindi superior, but silingon, we are looking for the inferior structure sa dalom sang mediastinum, which is the diaphragm. So, let me show you a picture sa aton nga mediastinum. So, in addition sa aton to proteins, most diverse, versatile, most abundant, more than 50%. So this is the mediastinum. So the anatomic region located between the lungs. So ari sa tunga ari siya. Mediastinum. That contains all the principal tissues and organs of the chest except the lungs. So ang mga important organs sa aton nga chest ara sa mediastinum except sa lungs. Ang heart nadala para sa iya. The mediastinum is a division of the thoracic cavity which contains the heart, the thymus gland, portions of the esophagus and trachea, and other major and important structures. So as you can see here sa chest x-ray, it appears white because it is radiopaque. So it is between the right and left radiolucent black lung fields. So ang atong mediastinum puti siya, radiopaque ara sa tunga. Sa tunga sang duwa ka radiolucent nga lungs because air inside the lungs are radiolucent. So, ang question to, diin kuno didto ang nabilong sa inferior portion. Of course, ang diaphragm ta ikyari sa dalong. So, ang the rest of the parts sa aton mga choices, ari di subabaw. We have here the trachea, the thymus. So, dira siya makita sa superior portion sang aton nga mediastinum. Okay, so next question. Which of the following refers to the mucosal folds of the small intestine? So, pila man siya kabes nagwa. So, choices are villi, hostra, rugae, and plicae circularis. So, ang mucosal fold sa small intestine is the plicae circularis. So, villi, so plural form na siya, vilos kung singular. It is small, slender, vascular projections. Magsiling nga projections, nag-protrude siya, nagagwa siya, that increase the surface area of a particular membrane. So, ang purpose ng villi, usually ang villi, makita na siya sa small intestine. Sa large intestine, wala sang villi. Pero hindi siya folds. So, they are vascular projections. So, ang question dito is folds. So, again, ang villi, makita siya sa may aton nga small intestine. So, ang purpose niya, it aids in digestion, absorption of food, secretion, and immune defense in the small intestine. So, again, they are absent in large intestine. So, in the large intestine, villi, microvilli, and crypts or the crypt cells are not present. And because of this, it offers much less surface area for the absorption of administered peptides and proteins. So, peptides, these are made of amino acids. So, sa aton ng large intestine, wala siya villi, kay ang main purpose man sa villi, again, to digest, absorb, secrete. So, ang aton na yung large intestine for waste products and absorption sang water. So, muna later, kung hindi ka makapamuson like 1 or 2 days, na-absorb na sa inyong large intestine ang fluid. So, tiga-tiga na inyo tae. So, mabudlay na pagwa sa muna may constipation. So, pero ang mga nutrients na iya, sa mga ginakaon ta, sa mga food, sa vitamins, so dira na siya gina-absorb sa small intestine with the help of the villi. So, amo niya tsura. So, ari siya, mga projections. So, sa microscope, amo niya tsura. Then next, for the hostra. So, singular is hostrum. So, the hostra are the folds of the uh, large intestine. So they are the small pouches caused by succulation. So when we say succulation, it is the sac formation, which give the colon its segmented appearance. So if you can imagine sa itsura sa large intestine, do chorizo na lang ginigot. So may mga sak-sak siya. So later may picture ko da. One rostrum distends as it fills, which stimulate muscles to contract, pushing the contents for the next rostrum. So kung mapuno na gani ang isa ka rostrum sang kinaon o sang kaime ngalin sa aton nga small intestine, so mahabok na siya, then it will signal the muscles sa next naman yung portion na mag-contract para magsaylo naman ang aton nga food or ang aton nga kaime. So amo na pushing the next pushing the contents of the stomach, contents of the large intestine to the next rostrum. So para nga mas maintindihan amo ni itsura. So ari ang hostra, amo na siyang bilog-bilog ito chorizo. So kung napuno siya gani, so makontract na siya para nga i-push niya ni sa next naman nga rostrum. Kung mahabok na siya, ma-contract naman ang muscles diri, masaylo naman sa next rostrum, and so on. So sa to nga, we have here do ribbon siya. Hindi siya ribbon nga laso ha. Do kung may birthday ni tangan siya ribbon. It is called Taenia coli. Diri nagulo halin ang term nga tae. The Taenia coli, these are 3 separate longitudinal ribbons. So kay ang Taenia, so that means ribbon, it is a Latin word. So they are composed of smooth muscle on the outside of the ascending, transverse, descending kag sigmoid colons. So ang part sa aton nga colon nga may Taenia coli are the ascending, transverse, descending kag sigmoid colons. So kung mag-contract na gani ang Taenia coli, it facilitates the peristaltic action of the large intestine para mag-push again sa next nga rostrum hasta makagwa na sa anus. So another term nga sa choices ta is the rugae. So folds man siya pero sa stomach siya yung makita. Rugae are a series of ridges produced by folding of the wall of an organ. Most commonly, rugae refers to the gastric rugae of the internal surface of the stomach. It provides extra surface area for the stomach to be able to spread out, stretch, and expand while eating. As food is digested, it is moved into the small intestine and the stomach becomes less full. As it shrinks in size, the rugae reappear as deep folds and wrinkles, similar to a shrunken balloon. So balin, ga-fold-fold na siya kung wala pa may kinaon. Pero kung magkaon tagani, so naga-expand na siya, nagalaba siya, nagadako. So kumbaga, do balloon siya, nga kung masudlan, kin isang hangin, naga-expand. And then, kung ang aton nga kinaon, masaylo na sa small intestine, so makupos naman na siya, amo na nga nagakurinot-kurinot siya, kaya tinakaagi siya stretch. So, the parehas gani, kung nasang balon, balang akong pakupusan, gani, hindi na siya smooth, di ba, mga pinilaan siya, nagayukot-yukot siya, so amo mo na itsura sang rugae sa stomach. So, amo na siya, hari siya, mga folds. So, kung damo yung makaon, naga-stretch na siya, so, nagatadlong na siya and then kung mag-push na ang food sa next na nga part sa atong nga digestive tract, which is the small intestine, so mabalik siya sa iya nga daan nga itsura, so amo na nga kurinot siya. Then lastly, we have the plicae circularis. So other term for plicae circularis, kay base hindi nyo na siya makita sa choices, valvulae conniventis or Kerkring folds or valves or just small bowel folds. So, damo siya term nga pwede ma-apply sa plicae circularis. So, folds na siya sa small intestine. Ang folds sa stomach is rugae. Ang folds sa aton nga colon is the rostra. The mucosal folds of the small intestine, starting from the second part of the duodenum, they are large and thick at the jejunum and considerably decrease in size distally in the ileum. So, ang aton nga mucosal folds, ang plicae circularis, so large and thick siya sa jejunum. So, matamat pa lang siya appear sa second part sa duodenum. And then later, paglambot sa jejunum, large and thick na siya. And then nagagamay siya ang mga folds pakadto sa ileum, which is the last part sa aton nga small intestine. It amplify the organ surface area, promoting efficient nutrient absorption. So magsiling gani nga amplify the organ surface area. Kumbaga may reserba, siya nga pwede pa siya kaunat, pwede pa siya ka-stretch. So this allows efficient absorption of the nutrients from the food we eat or sa aton nga mga supplements. So, amo ni tsura sa aton nga plicae circularis, ari mga folds. Tapos, sa mga folds nga ni, sa punta niya na, makita mo na ang mga villi. Okay, so next. Next na ta. So, next is the group of cells. Group of cells located in the wall of the right atrium of the heart and serves as the primary pacemaker of the heart. So, ang keyword nyo di is pacemaker of the heart, which is the sinoatrial node. Okay, so I will discuss the Purkinje fibers, bundle of His, AV node, and SA node. So sila na ang mga choices. So amo na siya ang amo na siya ang reason nga nagabit ang aton nga heart, may synchronized rhythm, and also nagasend sang electrical impulses. So the bundle of His is a part of the electrical system of the heart. Actually, tanan man to sila nga sa choices. Part of the electrical system of the heart. And it is a collection of cells that carry electrical signals from the AV node, from the atrioventricular node to the bundle branches. So ang bundle branches, part pa na siya sang bundle of His. The AV node controls the passage of the heart's electrical signal from the atria to the ventricles. Ang tawag siya nga AV kay atrioventricular nodes. After an electrical impulse is generated by the sinus node, tamo na ato nga sinoatrial node or ang SA node, other term na is sinus node, it spreads across both atria, so the left and right atrium, causing these chambers to beat. The SA node is the heart's natural pacemaker. Kumbaga siya na ang starter, bala. Siya na nagasugod sa pagbeat sa heart. So, amo na siya isa sa mga pinaka-importante nga part sang electrical system sang heart. So, kung ma-damage ang SA node, so amo na ang iba nagapa-install pacemaker na gina-implant para nga mag-help sang ilang heart nga mag-beat normally. The SA node consists of a cluster of cells that are situated in the upper part of the wall of the right atrium, and the electrical impulses are generated first at the SA node. So as I have mentioned, it is also referred to as the sinus node. For the Purkinje fibers, these are specialized conducting fibers composed of electrically excitable cells. So, amo na siyang pinaka-last nga part sa electrical system sang heart. Purkinje fibers allow the heart's conduction system to create synchronized contractions of the ventricles and essential for maintaining a consistent heart rhythm. They are the huge number of mitochondria in which fibers conduct cardiac action potentials or electrical impulses more speedily and efficiently than any other cells in the heart. So, isa sa mga important functions ng Purkinje fibers, so they conduct cardiac electrical impulses dasig more speedily kag efficiently compared sa other cells of the heart. So I also would like to discuss to you the 4 steps of cardiac conduction. So amo tong atong conduction of electrical impulses. So first, the step 1, pacemaker impulse generation. So the first step of cardiac conduction is impulse generation or to generate, to produce electrical impulses. So the SA node, which is again the pacemaker of the heart, contracts and generates electrical impulses or nerve impulses that travels throughout the heart wall. And this causes both atria to contract. So ari siya. Mauna anay diri sa SA node. So ma-generate na siya electrical impulses para nga mag-contract ang right and left atrium. So, right and left atrium. And then after that, the electrical impulses, ma-diretsyon na siya sa AV nodes. Ang AV nodes, amo na ang nag-conduct. Amo na siya ang ma-distribute, kumbaga, sang electrical impulses nga gin-produce, gin-generate sang SA node. So, the AV node can be found sa right side of the partition that divides the atria. So, ari siya. When the impulses nga halin sa SA node makalambot diri sa aton nga AV node, medyo may delay siya, pero gamay-gamay ang delay. Actually, mga 1/10 of a second. So, doon hindi mo na mabatyagan gani. These delays allow the atria to contract and empty their contents into the ventricles before the ventricle contraction. So, actually, dasig din siya natabo. So, ma-emit ni siya sa electrical signals, batuno na siya sa aton nga AV node. So, because of the delay, ito mga 1/10 of a second, i-prepare niya na ang left kag right atria nga mag-empty sang iyang sulod pakadto sa ventricles. So, before na siya mag-conduct sa electrical impulses, ang aton nga AV node, ang sulod sang aton nga right kag left atrium i-transfer, iula anay sa ventricles para mag-contract siya. Kag later, kung may sulod na ang ventricles, mag-contract man siya. So, kaya mo na gani nga synchronize. Hindi pwede nga pinagusto lang kung diin ang mauna open, diin ang mauna sira, diin ang ma-empty, diin ang ma-receive sang contents. So again, this delay allows the atria to contract and empty their contents into the ventricles before the ventricle contracts. So that is step 2. Step 3, the AV bundle impulse conduction. So kundi alin na di aton electrical impulses, so na-prepare na to ang atria, left and right atria, gin-empty na nila ilang contents sa ventricles. So, ang aton nga signals, electrical impulses, makadto na dayon sa kay tiging conduct na sa ang aton nga AV node, makanto na siya sa may bundle of His. So, aton bundle of His, ari siya, a portion, ari. This bundle of fibers branches off into 2 bundles and impulses are carried down the center to the heart center of the heart to the left and right ventricle. So, ari yung bundle of his, tapos matunga na siya sa bundles, ari, para maghatag sang electrical signal sa left and right ventricles. Ari siya ha. And then, the last step is the Purkinje fibers impulse conduction. So, at the base of the heart, the AV bundle starts to divide further into Purkinje fibers. So, amo na siya ang aton nga AV node, makadto na siya sa bundle of His or the AV bundle. Ang AV bundle, ma-divide na siya into bundle branches para sa right and left ventricles nga electrical impulses. And then later, ma-divide pag ini siya sa Purkinje fibers. So when the impulses reach the Purkinje fibers, they trigger the muscle fibers in the ventricles to contract. So masignal, kung makalambot hindi siya, so masignal na siya nga makontract na ang ventricles. The right ventricle will send blood to the lungs through the pulmonary artery, while the left ventricle will pump the blood towards the aorta. So again, the pulmonary artery will carry the deoxygenated blood from the right ventricle pakadto sa lungs. The aorta is the largest artery in the body, which will carry the oxygenated blood from the left ventricle pakadto naman sa iban nga parts ng aton nga lawas for circulation. So muna ang aton nga halin sa SA node pakadto sa AV node sa bundle of His, bundle branches pakadto sa right and left ventricles, and then ma-divide pagit siya further into Purkinje fibers. So in addition, ang ato ni nga parts ng electrical conduction sa heart, the SA-AV node, bundle of His, bundle branches, and Purkinje fibers, they have different rates or nagahatag sila different nga beats per minute sa aton nga heart. That's why it's important nga ang aton nga SA node will continue to function normally. Kaya di ba usually ang aton nga normal heart rate or beats per minute is about 60 to 100 beats per minute. So kung ma-damage ng aton nga SA node, so ang aton nga AV node ma-generate man sa sang iya nga electrical impulses so ma-beat siya pero hinay lang 40 to 60 beats per minute. The same man sa bundle of His. So hinay na siya. So ang beats ang heart hindi na siya normal. And then later kung ma-damage ang AV node or ang bundle of His, ang bundle branches kag Purkinje fibers sa left and right ventricles pakadto, so ma-generate man sang own nga rate. So that is 20 to 40 beats per minute. So kung ang naga-function na lang is the bundle branch or ang Purkinje fibers, so tama nagikahinay sang beats ang heart. So amo na kinahanglan tagid sang medical intervention. And also muna iba nagpa-implant sang pacemaker para ma-maintain ang normal beats per minute sang heart, which is 60 to 100 beats per minute. So again, amo ni aton electrical conduction from SA node pakadto sa AV node pakadto sa bundle of His, then ma-divide siya into bundle branches, right and left ventricles, and further will divide into left and right Purkinje fibers. Okay, so I hope that is clear. So naintindihan na siya guys. Nagutom na, dali na lang Nagutom na, dali na lang ha. Intindihan niyo lang so far. Hindi kayo intindi, kaya wala nagsasabat.
Understood, Doc.
Sige, thank you for the response. Sige. So next question is, so guidelines for cleaning objects or surfaces. So sa mga contaminated objects, so guidelines will include clean from the least contaminated to the most contaminated areas. So halin sa least contaminated, for example, kung ara ka halin sa tunga, ang contamination, so itipunon sa tunga. Kumbaga i-contain ta siya, so mo na from the least contaminated from the outer surface pakadto sa tunga. Kumbaga tipunon sa tunga. The same man na kung may mga nuclear spills or radiopharmaceutical spills, kung maula bala ang mga radiopharmaceuticals sa NUCMED. So gina-contain na siya. So tipunon sa tunga. So from the least contaminated to the most contaminated areas. And also, number 2, clean in a circular motion starting from the center and working outward. This is wrong. Kaya ni i-contain to siya kani, so dapat ibutang to siya sa tunga ang contamination. So sala na siya ang number 2. Applicable na yang number 2 when cleaning the intensifying screen. So, pero ang aton dia question niya for cleaning contaminated objects or surfaces. So, sala ang number 2. So, number 3, clean from top to down. So, which is also correct. Kaya ipapanaugon mo na siya para hapos maglimpyo. So, the correct answer is number 1 and 3. So that is for cleaning contaminated objects. So from least contaminated pakadto sa most contaminated, tipunon sa tunga to contain, and then from top to bottom. Next, in which of the following conditions is protective or reverse isolation indicated? So isa lang na ambot silingon ha, para sa na sila ang meaning sang protective isolation kag reverse isolation. So when we say reverse isolation or protective isolation, this means that we are protecting the patient because they have low immune system or weak immune system. So mga patients with transplant, so nubo na ila immune system, they should be protected. So correct. Patients who have undergone chemotherapy, so syempre ang ilan na nga immune system nubo man or weak. So, correct na ang number 2. And leukemia. So, syempre, kay nubo na ila, understood na ang nubo ila nga immune system. So, correct man. So, correct answer is 1, 2, and 3. So, I also would like to discuss the different types of isolation and precautions nga gina-observe sa aton nga medical or clinical setting. So isolation precautions are usually intended to keep yourself or as a healthcare worker protected from germs the patient may be carrying. So usually, kung magsiling kita, kung ang term na ginagamit is isolation alone, wala balasang naka-indicate nga reverse isolation. So kung ang term lang is isolation, meaning gina-protect ang aton self from other people. Or for example, if you are the healthcare worker, if you're the rad tech, you protect yourself from being contaminated by the patient. So, kumbaga, ang nagagamit kita mask, gloves, and other protective apparels, personal protective equipment, ang mga PPE para ma-protect the self ta nga hindi ta malatnan sang pasyente para sang spread sang COVID. So, ang mga rad tech nagasuksok na PPEs para nga hindi ma-infect ang patient nga possible COVID patient. Kung masiling naman nga reverse or protective isolation, ang patient naman ang ginahalungan ta. So especially itong na-mention ko, mga weak or low immune system na patients. So nagasok-sok kita sa PPE, hindi nga para nga hindi nga para kay nahadlo kang malatnang ka sa pasyente. But with reverse or protective isolation, we are wearing PPEs para hindi kita makalaton sa pasyente, para hindi ta madugangan ang balatian sa pasyente. Kay tungod gani kay weak ang ilang immune system. So it refers to the practice of healthcare workers and also the visitors to wear barriers or mga PPE, gloves, mask, goggles, routinely upon entry to the client or the patient's room for the purpose of preventing the patient exposure to external microbes. So, tandaan nga, usually ang aton pag-intindi ko anong kunos ang isolation kag quarantine the same. Pero actually, lain ang quarantine, lain ang isolation. Ang isolation niya, so pwede ka man gyapon mabisita, pero may mga extra precautions lang. Like for example, ang healthcare worker masuksok sa PPE. Pero pwede ka na niya makadtuan or ikaw kung makagwa ka, kung ikaw ang pasyente na isolated ka, so pwede man nga masuksok man sila PPE. So basta gina-protect nila ila self or ginasuksok na nila para ma-protect ang iban. Pero mas nga quarantine niya, limited gid ang movement mo. Dira ka lang sa isa ka lugar, hindi ka kagwa, kag as much as possible, hindi ka man pwede mabisita kung hindi taman ka importante, hindi for medical purposes. Okay? Okay. So, sterile corridor means an area of a surgical facility, so usually sa OR, designated primarily for surgical cases and surgical support staff. So, other terms for sterile, pwede kita makasiling nga restricted area, pwede man siya mambal nga limited access or controlled area or clean area. So, mo na yung nga definition sa sterile corridor, an area between the instrument table, so ari, and the drape patient. So, masiling nga drape patient, so nahabulan, na bala, usually ang green na bala nga habol to signify nga sterile na siyang patient. So, ang area sa tunga na that is what we call the sterile corridor and must not be entered by any non-sterile personnel. Dapat ang ara lang is ang doktor or ang staff sa OR or sa surgical room nga naka-undergo na sang surgical asepsis. So, notify proper personnel immediately if a sterile field is contaminated. Halimbawa, may aksidente nga nakaagi di, or for example, ang RadTech gintawag sa X-ray room, makadto sa OR, kay ma-X-ray sang pasyente, tapos dili ka nag-agi, so that will be considered contaminated. So, gina-notify ng personnel kay i-sterilize na siya liwat ang area. So next question is the medical abbreviations meaning 3 times a day. So 3 times a day, that is TIT. Para siya. So we have there PC, So, na-discuss na nakagina, post-sebum or after meals. So, BID, so B for by. So, meaning tandaan nyo lang, by, ti duwae. So, twice a day. So, it means bisinde. TID, 3 times a day or ter in day. Then Q is 4 for quarter bala, 4 times a day or quarter in D. QH is every hour. So kwake ora meaning every hour. So QHS naman kwake ora somni meaning every night or every bedtime. So every hour, then 4 times a day, 3 times a day, twice a day. Okay, so next question. Which of the following statements regarding heart valves is not true? So the valves between the atria and ventricles are called atrioventricular valves, which is also called a cuspid valves. Okay, so I will share the presentation sa screen. So ang not true, meaning ang false na da is the mitral valve is a semi-lunar valve. So allow me to share my screen. So again, the valves between the atria and ventricles are called atrioventricular valves or the AV valves. So are right and left na siya. The right AV is the tricuspid. So are may tricuspid today. The left is bicuspid or mitral valve. And then the valve between the right ventricles and the pulmonary trunk is the pulmonary semi-lunar valve. So the aortic and pulmonary valves are located between the ventricles and the arteries that emerge from the heart. These valves are also known as the semi-lunar valves. So ang aortic and pulmonary valves, they are semi-lunar valves. Tapos ang ato naman nga mitral valve, amo na aton nga left AV valve or the bicuspid valve. So ang aton to nga choices. So mitral valve kuno is semi-lunar valve. So this is wrong kay supposedly ang semi-lunar valve amon to ang aton nga pulmonary kag aortic valve. Ang mitral valve is the bicuspid valve. Okay, so next, skeletal muscles are attached to bones by so kagina ang bago to ang ligaments bones to bones. Ang tendons muscles to bones. Okay? So muscles, skeletal muscles kag bones, this is tendons. So ang bursa is a tiny slippery sac of fluid that provides a cushion and reduces friction between the surfaces of a bone and soft tissue. So as you can see here, we have here the bursa. So ligaments, so they connect bone to bone, tendon, so muscle to bone. So muna tandaan nyo para hapos. So tendon, muscles to bones, ligaments, bone to bones. So wala siya ha. So, ligament, bone to bones, tendons, muscle to bones. Okay, so next question is, during a grand mal seizure, the patient should be blank. So, magsiling kita nga grand mal seizure, so mo nagakirig-kirig, hindi siya kurug-kurug, nagakirig-kirig, so naga-seizure ang patient, especially kung may mga epileptic attack. So, ano ko na dapat obrahon? So, first choice, give a sedative to reduce jerky body movements and reduce the possibility of injury. So, it is not advisable na tagaan sedative ang patient kung naga-seizure. So, ang ina-advise na gani is pabayaan lang siya, basta kay kumbaga naman na joke, malang pabayaan na siya kay mampawan na sa. So, kay basta i-secure lang ang environment nga hindi siya ma-injure during the course of the grand mal seizure. So, number 2, allowed to thrush freely. So, silingon, pabayaan mo na sa magwaras, pero hindi siya freely, kay tungod nga gina-check mo, gina-secure mo, kung basi may masalapay na siyang matumbahan siya, like kung sa hospital, masalapay niyang oxygen tank, matumbahan siya, or whatsoever na pwede makakause untoward incident. So, wrong man ni siyang ang second choice. Ang third choice, placed in a semi-upright position to prevent aspiration of vomito. So, hindi mo na siya mapapungko or mapaidag ang patient or mapa-semi-upright kay hindi niya na makontrol gani ang iyang movements ng muscles niya. So, ang pinaka-best kida is protect from injury. Pabayi lang siya kung nag-seizure na siya, basta i-make sure lang nga hindi siya ma-injure. So, in case nga masuka siya or may vomit siya, so, amo na ibantayan lang siya bala. So, patakilidon siya para nga hindi niya matulon niya suka, hindi siya madunlan. So, correct answer is should be protected from injury. Next is omphalocele. So, omphalocele means, so ang cele, C-E-L-E, so it means herniation. So, omphalu is a medical term which means or refers to the navel or the umbilicus or sa pusod. So, meaning, this is a hernia of the navel, congenital hernia of the navel. So, that is the omphalocele. So, to add information on the seizure, meron kita dua ka classes ang seizure, the grand mal and the petit mal. So, ang petit mal, amo na siya ang daan nga name, ang bago subong is absence seizure. So, ang grand mal seizure causes a loss of consciousness and violent muscle contractions. So, violent, hindi mo ganun, hindi na makontrol ang mention ko kagina. It's the type of seizure most people picture when they think about seizure. So, usually, kung masiling kita ko or makabati kita sa term na seizure, usually, amo na siya atong gina-imagine. So, actually, duwa na siya gali ka klase, grand mal kag absence seizure or the petit mal seizure. A grand mal seizure is caused by abnormal electrical activity throughout the brain. So, hindi na normal ang ginasend niya nga message. So, mo na nga hindi makontrol ang movement. An absent seizure or the petit mal causes you to blank out or stare into space for a few seconds. Usually, yung mga nagkakaurungan, bala ko, no? Pero hindi na normal ang kaurungan kung may pinagdadaanan. Kaya, so, kakaurungan ka, absent, ginaya, blanco, ka ginaya. Pero, ano lang, in a matter of seconds lang siya. So, hindi mo gani kung ikaw ang pasyente na maka-experience ka sa ang absent seizure. So, hindi mo siya gani hindi mo siya ma-notice na nag-undergo ka na seizure. Kay seconds lang, dasig lang. So epilepsy or seizure, so usually 'di ba kung magsiling kita nga epilepsy gina-associate sa dayon sa seizure. So there are actually three types of seizures, which is the grand mal, the petit mal or the absence seizure, and the psychomotor seizures. So grand mal, generalized seizure, involves tonic, clonic movements. So magsiling nga tonic, stiffening, gaplanig ka, then clonic is twitching or jerking ng nuga pisik ka gulpe. So tonic, clonic movements, and iban loss of consciousness. Pero amo na gani nambayan na sila kayo maampawan na gina sila. So isecure lang ang environment nga hindi sila ma-injure. Petimal, sudden impairment or loss of consciousness. So sa iban nga kalipong na gulpe. So mera iban nga naga-experience tonic-clonic movement pero very minimal or iban wala gid. Or iban man vacant facial expression, nagkakaurungan siya, eye straight ahead. Sa psychomotor, sudden change in awareness, so inang gulpi lang ga lain ang iyang pamatyagan kay daw na maguhan siya, daw nalipat siya kung sa diin sa, behaves as if partially conscious. So, conscious siya nga daw hindi man, luhubog, may appear intoxicated, and iban ng antisocial behavior, pwede sila maging violent. So, that is also a sign of psychomotor seizure. So, ang naman sa hernia, so herniation, magsiling kita herniation to protrude through an abnormal body opening. So this is an example sa picture, the example of omphalocele. It is a birth defect of the abdominal wall or sa belly or sa navel. So ang gagwa sa iyang pusod, ang iyang intestines, iban liver or other organs. So the organs, as you can see there as a picture, are covered in a thin, nearly transparent sac. So the organs are covered in a thin, nearly transparent sac. So some babies, naga-occur na siya because there is a change in their genes or sa chromosomes, and may also caused by a combination of genes and other factors, especially sa mga ginakaon sang nanay during pregnancy or sa iyang environment or sa mga ginainom niya. So pwede siya maging cause. Pero again, wala siya sang exact gid nga ma-pinpoint gid nga cause. So kumbaga anong gid ang origin origin. So another one, we have here the perennial hernia. So it is a hernia involving the perineum. So when we say perineum, this refers to the pelvic floor. The hernia may contain fluid, fat, or any part of the intestine, the rectum, or the bladder. So, ari siya nag-ulbo siya. So, again, masiling kita nga cell or omphalocele, hydrocele. So, it means swelling, hernia, or tumor. So, next will be the lag rolling is a method of moving patients with suspected spinal injury. So, ang main purpose gid sang lag rolling is to prevent kag hindi madugangan ang spinal injury sang patient. So, the purpose of lag rolling is to maintain alignment of the spine while turning and moving patient who has had spinal surgery or may suspected nga spinal injury. So, ang recommended ko no is at least 3 ka persons ang ma-perform sang lag rolling. Ang isa, mauyat sa head. Ang isa, sa upper trunk, dire. and then ang isa sa lower portion sang iyang thoracic cavity or sa thoracic area o sa lower abdomen man eh. Kung apat, mas mayo man kay mara pagin mawiyat sa tiil. Pero amo nang recommended at least 3. Kung duwa, pwede man, pero amo na medyo budlay siya. So, ensure nga synchronize ang movement kay base ang isa nagliso na itong ihawak tapos ang iya nga ulo wala pa gali nakaliso or ang tiil yan nabilin pa. I-ensure man nga ang kamot niya nga hindi magwayway, uyatan siya, kay base ang kamot ito nabilin, kundi amo man gyapon, nagtiko man gyapon iya nga alawas. So again, lag rolling for spine injury para ma-minimize ang injury sa spine. Next, which of the following is a violation of correct sterile techniques? So, ang violation na di sa ato nga choices, persons in sterile dress should pass each other face to face. Kaya dapat back to back. Kaya kung naka-sterile gown ka na, naka-surgical asepsis ka na technique, so ang imo na nga likod is considered unsterile. So, dapat kung magsugataay ka mo, mag-agyanay ka mo sa upod mo sa room, sa OR, sa surgery, so dapat nagatalikod when you pass each other. So what parts of a gown or surgical gown are considered sterile? So muna siyang may green area ha, muna siyang considered na sterile. After donning or after nasuksok ng surgical gown, the only parts of the gown that are considered sterile are the sleeves. So, muna sleeves. Except, wala na labot to sa ilok eh. And the front from waist level to a few inches below the neck opening. So, kung narito ang neck, so a few inches, so sterile na siya. Diri hindi niya na sterile. So, muna ganing, kung maglabay ka sa isa ka-staff sa room, so hindi ka mo magtubangay. Do not pass each other face to face, but back to back. If the gown is touched or brushed by an unsterile object, it is considered contaminated. So, mailis ka naman bago, ma-perform ka naman sang surgical aseptic technique. So, muna ganing iban ginapasaka man na ang kamot sa babaw to maintain the sterility. So, how should sterile team members pass each other? So, sterile team members should stand back at a safe distance from the operating table while draping the patient. So, kung ginahabulan ang pasyente, ginatabunan ang pasyente, so dapat hindi magdikit sa table or sa patient mismo. So, dapat may safe distance from the table. Also, should pass each other back to back. A sterile team member should turn his back to an unsterile person or area when passing. So, for example, kung may nagsulod nga radtech, kay ma-x-ray ang pasyente, so dapat matalikod ang sterile member sang team. So, hindi niya pagkatubangon. So, na siya ha, important nga dapat tandaan. So, sequence of one sterile person going around another. So, muna ay nagtalikdanay ha, talikdanay. May safe distance, syempre, hindi pwede talikdanay ka mo tapos nagabagudanay man inyong likod. So, hindi man pwede. So, dapat may safe distance with each other. Okay, so, next question, the type of shock caused by severe blood and fluid loss. So that is hypovolemic shock. So shock ang iyang condition is life-threatening. It is a life-threatening medical condition and considered a medical emergency. So usually, ang main symptoms ng shock is low blood pressure. So usually, ang person na kung under shock, nagaplang lapsig, aplang yami, kay low ay nga BP, di mayo, wala mayo, nag-circulate ay nga blood. So aside from low BP, rapid shallow breathing, so do ginahapo, nalaga siya pag ginawa, mayami, tugnawan, so clammy skin amo ng mayami, rapid dasig pero weak ba lang yung pulse, galingin ang ulo, dumalipong or nagapalang luya. So there are several types of shock and they are categorized as two: septic, anaphylactic, cardiogenic, hypovolemic, kag neurogenic. So septic caused by bacteria, anaphylactic shock due to hypersensitivity or allergic reaction like sa food, sa environment, sa inanimate objects. Cardiogenic, so from the word cardio, so due to heart damage. Hypovolemic, due to blood or fluid loss. And neurogenic shock from spinal cord trauma. So, in addition, so halini siya sa kay Ehrlich nga libro, so iya gini karadtek nga patient care. So, shock is a general term used to describe a failure of circulation. So, muna bagani ko nga kagina, na wala nag-circulate na yung nga blood, amo nang ano po, BP. Failure of circulation in which blood pressure is inadequate to support oxygen perfusion of vital tissues and is unable to remove the byproducts of metabolism. Basta hindi na mayo yung circulation, so pwede siya nakakause shock. This is dangerous, potentially fatal condition. So, muna ginamba ko gani kagina nga it requires immediate medical attention. So, it can present pallor, increased heart rate and respirations, restlessness, or confusion. So, muna to ang 5 types na na-discuss ko, kagina na-mention ko. So, hypovolemic shock or low volume shock. So, nag-occur na siya when a large amount of blood or plasma has been lost or insufficient amount of fluid is available to fill the circulatory system. So, tamaan na kanobo sang iya nga fluid level sa lawas. So, mabudlayan ang circulatory system nga mag-distribute sang blood sa lawas. So, this may result from external hemorrhage. So, pwede nga makause ang external hemorrhage, lacerations, o mga disgrasya na severe dehydration, etc. So, basta mo na hypovolemic shock, large amount of blood or plasma or fluid has been lost. For septic shock, so there is a massive infection. So, magagrabe So, such as one caused by gram-negative bacteria that produces toxins which increase capillary permeability in vasodilation. So, septic shock, naganubo man na nga BP. So, although radiographers seldom encounter this type of shock, we may see it in an intensive care unit or sa emergency department. So, ito na pag-discuss yung iba na. Neurogenic shock, failure of arterial resistance causing a pooling of blood in peripheral vessels. This occurs in reaction to an injury to the nervous system. So, nag-occur ang neurogenic kay neuro. So, injury sa nervous system and demands immediate drastic intervention, especially kung may head or spinal trauma ang patient. So, amo na siya for neurogenic shock. Then for cardiogenic shock, so cardiac failure or may problem, may interference sa functions ng heart. So, pwede nga na wala nag-function iya heart because may nagsangal, may pulmonary embolus, or pwede nga due to reaction sa anesthesia. And for the allergic shock or anaphylactic shock or anaphylaxis. This occurs when individuals are exposed to foreign substances to which they are sensitized. So kung limbawa nakakaon ka, kung allergic ka sa pasayan, nakakaon ka pasayan, so pwede ka mag-suffer from anaphylactic shocks. So amo niyang common sa nga ma-encounter sa radtech, especially kung naga-introduce kita contrast media sa aton nga patient. So again, to summarize, so septic shock results from bacteria, anaphylactic shock, hypersensitivity or allergic reaction, cardiogenic, so damage sa heart, hypovolemic, severe blood loss. So mga ginapangwakal ko muna mga keywords niyo, mga importante tandaan. Hindi kailangan sa uluhon tanan. Neurogenic, so may injury sa spinal cord, or may due to traumatic accident or injury.